Hello, we are just waiting for a couple more people to join us and we'll get started. Happy Friday. Okay. Okay, so before we begin, this is just a reminder that we cannot see or hear you, but you are welcome to ask questions using the Q&A feature of the webinar. Please only use the chat feature for technical support. The presenters will be looking at Q&A at the end of their presentation and answering your questions at that time. So either if you have questions during the presentation, please write them down, or you're more than welcome to write them in the Q&A field and they will get to it when they're finished. This webinar will also be recorded and uploaded to the CSCLA website, and I will type that into the chat shortly if you would like our website. And for those of you that are not familiar with our organization, Cancer Support Community Los Angeles is a nonprofit whose mission is to ensure that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community. We provide a safe place for patients and loved ones coping with cancer to build social and emotional support as a supplement to medical care. Provided at no cost, we offer support groups, educational workshops, healthy lifestyle classes, counseling, family programs, and social events. Joseph, if you don't mind going to slide 1 for me. Okay. Just a little disclosure, the following slides were updated and medically reviewed by Thomas LeBlanc, MD, in April 2020. Slide 2. Okay. This program was developed by Cancer Support Community. We developed the content independently and then had outside medical and psychosocial experts review it. CSC has final control over the content of our programs. This program was generously sponsored by Pfizer Oncology, and the presenters were engaged by Cancer Support Community Los Angeles. So without further ado, I will introduce your presenters for today. Today we have Rocha and Joseph Greenberg of Providence St. John's Health Center. Rocha is an adult gerontology nurse practitioner and has been a registered nurse for 15 years in various settings in oncology. As a nurse practitioner, she collaborates with the multidisciplinary team to provide survivorship care in the outpatient setting at Providence St. John's Health Center. She's focused on improving quality of life through prevention, surveillance, maintenance of late effects, and psychosocial impact of cancer. Anna is joined today by Joseph Greenberg. He is a clinical oncology social worker at Providence St. John's Health Center and John Wayne Cancer Center Clinic, Joseph has worked in the field of medical social work since 2013. His clinical interests involve applying modalities of cognitive behavioral therapy, mindfulness meditation techniques, and other forms of supportive therapy. He's been a part of the Multidisciplinary Cancer Treatment Center at the outpatient cancer clinics at Providence St. John's since March of 2018. So without further ado, I will leave it to our presenters. Thank you, guys.
Thank you.
Thank you. So this is our overview for the workshop. We hope that by the end of this presentation, you'll have more information about treatment planning basics, choosing your treatment team, setting goals, learning about guidelines and pathways, treatment options, caregiving, and have time for some questions and answers. Next slide, please. The objectives are to learn how to recognize your treatment needs and how to respond, to be knowledgeable about your diagnosis and treatment options, learn how to build your support system, ask questions and advocate for what you need, information for caregivers and making treatment decisions, and how to make choices that are right for you. Next slide, please. Together with your team, you will discuss the different factors that will play a role in the treatment options, such as your age, your point in life, including your family, life, and work situation, your overall health, your expectations for treatment, available resources and support system, logistics, including transportation needs, costs, and any additional questions that you may have. This is a good time to kind of consider, where you are currently, prior to starting any treatment. If you're already needing help caring for yourself, for example, or if you have any religious or spiritual beliefs, cultural or dietary restrictions, or if you've received other treatments in the past, these are things to bring up with your team. The decisions you and your medical team make about treatment should reflect you, your condition, your personal situation, and goals. Next slide, please. Understanding your diagnosis. There are some tips to fully understand your diagnosis, such as ask your team to tell you exactly what kind of cancer you have and to write it down for you. If you don't fully understand, do not hesitate to ask questions. Sometimes the initial shock of the diagnosis may leave someone more quiet than normal or thinking. So this is a time to really write down what what's going on, what you're thinking of. So ask for a copy of your printed results. Ask your team what they base their treatment recommendations on. Talk with your nurses. Talk to other people who have had cancer, especially those with a similar diagnosis. So everyone will want to share their experience or their story, but know that each cancer journey is unique. And be cautious about where you gather your information. There's a lot of information, a lot of blogs, a lot of different websites touting treatments that may be too good to be true, and oftentimes they are. So just be wary of that. Next slide, please. Understanding your diagnosis. So questions to ask: what type of cancer do I have? For example, if it's breast cancer, you want to know, is it ductal, is it lobular, is it mixed? There's a lot of different subtypes. There's also biomarkers, receptors, and mutations. So information to know and to ask. What stage is my cancer and what does it mean? The stages of cancer are 1 through 4, and there are many levels in between that. So some cancers remain highly treatable, even at stage 4. What symptoms of cancer might I experience? The most common experience of a person with cancer is fatigue. Even before they've started treatment, they may have fatigue already that has been going on. And what other types of tests will you need, such as other blood work or genomic studies, genetics, imaging, and where can I get a second opinion? I always recommend patients to go get a second opinion if we are their first opinion. I think it's very important to learn as much as you can about your cancer and treatment options. You can then compare recommendations, and it's not considered rude to get a second opinion, and you will not offend a competent team by getting a second opinion. Next slide, please. Choosing your healthcare team. I think it's so important that you have or develop a good relationship with your team. Some questions to ask may be, how much experience does the team have with treating your specific type of cancer? When you meet the provider, you will know within the first few minutes if you will click, if the personalities match, if the communication meets your needs. And then you also want to ask about response times, how responsive they are to your questions that you have. You want to develop that mutual respect to effectively work together. Other questions to ask are about support services that might be available, and maybe even ask for a tour of the facility. Overall, feeling comfortable and confident with your team is key. So your choice of team and cancer center may ultimately depend on the type of cancer and stage, your preference, insurance coverage, and logistics, such as transportation, distance, and cost. Next slide, please. Possible members of your healthcare team include the following: the medical oncologist, which would be responsible for the drug therapy that you may receive. The surgical oncologist will be responsible for the surgery specific to your needs, and radiation would focus on the radiation treatment. There are many other members of your team, and knowing what you have available at your site is important. Make use of all the resources. Everyone has a distinct role and specialized services that they can, specialized training and services that they can help you through this cancer journey. Next slide, please. Other members, just as important, are the registered dietitians and to help optimize nutrition, also rehab to help improve mobility or prevent mobility loss, along with the nurse practitioner, physician assistant, clergy, palliative care, and home health aides. So very important. Next slide, please. Palliative and supportive care. Sometimes palliative care gets a bad rap. Most commonly, misinformation about palliative care is that it's end-of-life care, but it is not. It's actually used to treat many other chronic conditions such as heart disease, chronic kidney disease, COPD, multiple sclerosis, liver disease, not just cancer. So palliative care focuses on providing patients with relief from symptoms, pain, and stress of a cancer diagnosis. And palliative care can start at any time, stage 1 to the end. So, you know, palliative care serves a very good role, and it's not just for the patient, but also for the family members as well. With palliative care, you can continue your current treatment. That doesn't mean you stop the chemotherapy or radiation. And then just to help more clarify, hospice is end-of-life care, which is not the same as palliative care. Hospice is for someone who has a terminal illness and has less than 6 months left to live, and either decides not to continue with treatment or there's no other treatment options available. The focus of hospice care is comfort care and managing the symptoms and pain. So that's the difference between palliative and hospice. Next slide, please. Preparing for your visit, write down questions before you go to the team. Bring them to your appointment and use them to talk to your healthcare team. So people with cancer oftentimes lose sleep just before their first visit or after the diagnosis, and even throughout. So I always tell patients to go ahead, and if you're losing sleep, because those thoughts tend to come around bedtime, to write everything down, keep a notepad by your bed so that you put it on the notepad, and then know that the next morning when you wake up, you can ask these questions of your team. So it's very important to write these things down. If you'd like, you can ask the team if it's okay to go ahead and record the visit. I've had many patients do this, and this is not a problem. That way they can refer to that recording later on when they're at home, and when the shock or anxiety nerves tend to wear off. You can also write down a list of medications that you're taking, such as the dose, the name, how often you take it, and what you're taking it for, and take it with you to your visit. Very important. Next slide. Key points. So be upfront with your team. I think communication is vital. This is definitely a relationship that you'll develop over time with the providers, and making sure that they hear you, and if you have questions, doubts, or concerns, you raise those to their attention. Try to stay focused on what's happening right now rather than trying to make decisions all at once. Ask to sit down with a financial or insurance counselor at the center to help you understand and plan for costs. Understand things and how you feel about them, and take advantage of the available resources. And
Right.
Next up is Joseph. So, okay.
Yes, thanks, Anna. I'll take the next slide here. And also just to really encourage, if you have concerns about bills or the financial aspects, definitely ask your team. I'll be repeating that line a lot in our talk today. Ask your team. So you can definitely get pointed into the right direction as far as how to better manage it with a payment plan or with other insurance resources. So the financial concerns are often top of mind for people. But so going on to this, the empowerment approach. Set your goals, find your strategies for those goals, and ask for help. That's kind of a theme. And forgive me for moving my mask around during the talk. As I move my mouth, it moves around in my face. And Anna and I are staying COVID safe here as we wear our masks in the workplace. So I just wanted to represent that. So if there's an area or an issue as you go through the treatment process that you're struggling with, chances are very high that it's very common and that there is things to support it. So don't hesitate to ask whatever it is. I wanted to share a quote by Viktor Frankl, who was an Austrian psychiatrist who survived Nazi concentration camps. And he wrote the book Man's Search for Meaning, which people might be familiar with. But his quote was, "When we are no longer able to change a situation, we are challenged to change ourselves. Everything can be taken from a man but one thing, the last of the human freedoms, to choose one's attitude in a given set of circumstances, to choose one's way." So I think that point really rings true with no matter what the circumstances someone is facing, whatever hardships they are, to try to be aware of that you can control your attitude and your perspective. And I know with experience with working with people who've gone through cancer, you might not, obviously will not adopt that viewpoint right off the bat, but and you're entitled to feel sad, to feel angry, to feel a loss of everything. And it might take time to get to the point where you can say, okay, here's how I'm going to be in this situation. This is the attitude I'm going to adopt. But it will be a work in process, and it can be done. So shared decision-making is an idea about just building the relationship with the medical team, I think, and making the decisions together. It's you and your health care team discussing the available treatments that align with your values, your goals, and your living situation. And your values and goals, it's an ongoing process, and your values and goals can change over time, and your available treatments may change too, depending on the type of cancer. So it's a collaborative process, and communication is certainly key. So understanding your values, important to kind of to think about what matters to you in different life settings, or scenarios in life. So some examples might be being active, being able to, for example, being able to play or roughhouse with young kids if you're a parent, or go on walks and trips. Being healthy to attend a certain event like a birthday or a graduation, or seeing a son or daughter get married, or for a special anniversary, to be able to attend that. Valuing a few side effects. So that might be an important value. To not live indefinitely with feeling ill or pain, or not being able to take care of yourself, not recognizing that's not something that you want to go through. And then conversely, having the best treatment, valuing having the best treatment available, and wanting to pursue treatment at all costs, and not necessarily focusing on quality of life, but wanting quantity and trying to have the most time as possible. So here's some different life arenas to talk about or think about goals in these areas. So when you talk to your team about options, you want to know the goals and the treatments for each, and how the treatment might affect the goals that you have in your life. Possible goals might be to live as long or as well as possible, or make it to the special event or milestone, like I mentioned. And the example that I mentioned before too, the parent with a young child who wants to be able to play hard, lift, or hold in order to be able to fulfill that role, and that ability might be impacted by the treatment, like radiation or chemo, for example. But by talking about that concern with your team, it might lead to new understandings, different perspectives on the side effects not being permanent, so that you know that you're going to be able to return to your normal functioning in a certain amount of time. Or maybe utilizing physical therapy for rehabilitation to build strength or recover strength faster, and then exploring new ways of what being a parent is. It might not, are there other ways to kind of focus on, instead of being the physical, strong, rough play, but doing other things like maybe it's spending more time like reading books or at bath time or at meal time has different significance, those kinds of things. And then I'll quickly touch on work school, because I think that's important. But yeah, knowing is it important to you to be able to try to push through working while you get treatment, or is it better to work from home and fully rest and recover instead of doing that, which might lead to a faster recovery time. So talking to the team, you'll kind of know better how to approach that situation. Okay, and continuing on different goals in different areas, community involvement, personal and spiritual growth. I'll just say about community goals, it may look different depending on what stage in treatment of the cancer that you're at. There may be reasons that someone might want to keep a cancer diagnosis very private, or perhaps only let immediate family know. However, generally, I think a person's circle of support is strengthened when they know what is going on and how they can help. This might be friends, close colleagues from work, interest groups, as well as your faith community. So different things to consider about those goals and what else is important. So important tools to help with common concerns. Important documents for everyone, an advanced directive, which we use a lot here and talk about a lot. It's not just for people with cancer, it's for every person over the age of 18 who has decision-making ability. And this is a wonderful document. It's offered, and it's so you can make advanced, you can identify someone. It allows you to document what is important to you regarding your healthcare wishes. You identify someone who can make decisions for you in case you are unable to communicate, and determine what kind of life support measures you want to be undertaken at that time. And people generally feel a greater sense of control when they have completed their advanced directive, and it's a gift, I think, of clarity for yourself and for your loved ones to know what you want instead of having to determine without having your own input reflected. And then all on here as well as a durable power of attorney, which you can have both one for financial resources like your house and assets, and then you can have one, a durable power of attorney for medical, which I believe is on this page too, which is essentially just identifying the same thing as the advanced directive. You're identifying a person to make decisions for you. However, the advanced directive allows you to elaborate more in different areas with information. More information in this area includes a DNR, which is a do not resuscitate order, which is entered into someone's chart when they have made the decision with their medical team that they prefer to not have heroic measures taken in the event of cardiac or respiratory arrest. These measures are things like having your heart shocked, having your chest pushed on during compressions, or also being placed on a breathing machine. So if someone in conversation with their medical team does not want to go those routes, they would enter in, ask for a DNR order to be entered in, and that's what would happen. And then additional to that is a POLST form, which is a physician order for life-sustaining treatment, which complements an advanced directive, but not intended to replace it. And it guides the discussion more in a detailed way as far as what type of care they want at that situation of serious illness, and gives actionable orders in regards to care a patient wants between CPR, full treatment, or selective treatment. So I encourage you to search those information and resources online for more info. I'm moving on. So key points along this whole path is just to break the whole thing as much as possible into smaller, manageable pieces. Try taking it one day, 1 week at a time. If it feels really difficult at the front in the first day, the first weeks, know that emotions change, and after the passage of some time, you will start to feel better, and like you'll have more of a hold on what's going on once you have your plan in place. So it will is much more manageable when you kind of avoid thinking about everything at once and breaking it into small pieces. So with that, I'll hand it back over to Anna to continue the talk.
Thanks, Joseph. And I just wanted to comment. I'm very passionate about advanced directives. So I just wanted to make a mention, you know, advanced directives are things you can change. They're not permanent or set in stone. Once an advanced directive has been put in place, just be sure to revisit it using the 5 Ds. So at least once every decade, if there's a death or new disability or diagnosis, or if there's a divorce. So those are the things that would prompt review of the advanced directives you have in place, and that's all I'll say about that. So going on with treatment options. So how did your team come up with the treatment options that you have? It's estimated that about 75% of patients are unaware of this new approach to systemic cancer care. So there is a focus on developing evidence-based standards. It helps both teams and patients make informed treatment decisions. And these two basic approaches are called guidelines and pathways. Next slide, please. Guidelines. So guidelines are based on a specific subtype, genomic profile, and stage of cancer. Panels consisting of cancer specialists such as surgeons, oncologists, radiation oncologists, pathologists, primary care providers, experts in psychosocial care, and patients help make these guidelines. The guidelines are developed based on what is known to work best for treatment, and cost of treatment does not typically impact the guidelines. So one example of this is the National Comprehensive Cancer Network. They are most transparent, available online, and their guidelines apply to about 97% of cancers. One example, another example of these guidelines, or looking at this guideline, is, you know, if there's a new diagnosis, you look and see, and it will tell you exactly what the workup would need to be to have a full and complete picture of the cancer diagnosis, what other imaging studies need to be obtained, and then it literally is a flow chart of what to do next, and if there's a recurrence or if it's stage 1. It's very well laid out and evidence-based, which is very important. Next slide, please. Pathways are shown to improve quality of care by ensuring that patients receive the most proven therapies rather than unproven and expensive ones. Pathways include preferred drug choices. So one example of this is perhaps the insurance pathways, which may cover a specific drug before they'll cover maybe the drug that was prescribed. So pathways are primarily developed by providers and third-party vendors. And in some cases, oncologists receive financial incentives for adhering to these pathways. So be sure to ask your team what approach was used to determine your treatment options. Next slide, please. And I'm going to go back to Joseph.
Thanks, Anna. Okay, so questions to ask about treatment options. So generally, just what you want to know is what is the goal? Why are you recommending it? What are the benefits and risks? And how can we prepare to manage the potential side effects? These are great questions to ask and try to build and prepare a plan. And you know, I think I encourage people to set up people or a care network that can check in on you if you're by yourself, friends or family, and you know, have yourself prepared that way. And a specific example of things that might be able to help managing side effects, and if you're at home and it's harder to get around, is something called home health, which can involve having physical therapy, an RN, or occupational therapy support done at the home if someone has gone through loss of strength and needs some support that way. So those are good things to be aware of. So further questions: how often will treatment be given, and where? Is it going to be 5 days a week? Where exactly is it going to happen? Or is it going to be more like once every 3 weeks? Is it given via, is the treatment given like an infusion? You're going to be in an infusion chair for several hours, or taking a pill? Knowing how long the treatment lasts will allow you to plan your day of the treatment. And does the facility where your treatment has or is being given will offer, are there emotional support resources available? So these are also good things to help. You know, and just kind of like understanding if is it realistic to take, you know, to work through treatment, like I said before, or take time off. How much energy should I expect to have through treatment? Some people are really surprised when they're just shocked by the level of fatigue that they have, and that can be accompanied by thoughts, negative thoughts, like, you know, why I can't do what I normally do. This is awful. And by just kind of asking, like, well, what are going to be the side effects? You'll have a better idea of what to expect. And okay, like, I'm supposed to be feeling this lethargic, or I have to sleep for this amount of time a day. So you'll have a better understanding. Are there resources that help with transportation if you need daily treatment over several weeks? You talk about that. If someone's coming from further away to their treatment location, there may be ways to get medical scans or treatments at facilities that are closer to where you live and that are, you know, in communication with the actual providing team. At several larger cancer centers, including Providence, St. John's, we do have emotional support services from our team, as well as counseling and an oncology specific psychiatrist, as well as registered dietitians and chaplains and more. So sending it back over to Anna.
Thanks, Joseph. This slide, we're going to talk about treatment options. It's going to be a very brief overview of some of the different options that might be available. Many times there's more than one treatment option. Sometimes it may utilize 3, just based on guidelines or whichever pathway the team is following. So next slide, please. Chemotherapy is a treatment that involves the use of drugs to destroy cancer cells. The chemo travels throughout the body, which can then kill any cancer cells that may have spread or may be microscopic and not visible on any imaging studies that you might have. So chemotherapy can be given through an IV, pill, injection, or applied directly to the tumor. Chemotherapy is a systemic therapy. So next slide, please. Radiation therapy. About 50% of patients receive radiation therapy at some point. External radiation is delivered by a machine aiming high energy x-rays at a specific body area. Treatments are usually once a day for several weeks, or even once a day for 3 or 4 days, depending on the goal of treatment. Radiation works by damaging the DNA inside of cancer cells, slowing the growth, and causing cell death. The target area is typically local, but it can also be systemic. So internal radiation that uses seeds, ribbons, capsules, or liquid placed inside the body. Inpatient treatment may occur until body no longer gives off radiation at a high level. So next slide, please. Surgery is the most common form of cancer treatment, and it's used either alone or in combination with other treatments. Surgery may be used in determining what type of cancer you may have, and this may be done using a biopsy, which takes a small piece of the tumor tissue so that the pathologist can review that and perform additional studies or stains on it to help identify what type of cancer you have. Staging surgery will determine how the cancer has developed, and that would include sometimes lymph node, sentinel lymph node biopsy, or lymph node dissection. Treatment would be to remove the entire tumor if possible, so that the margins are clear. Debulking is reduction of tumor that cannot be fully removed. So in this case, it may be done to help alleviate any pain that the tumor may be causing or prevent damage to nearby organs and tissues. And then there's reconstruction to help restore function or appearance of the body. Next slide, please. Targeted therapy. So targeted therapy is a more precise therapy. It attacks cancer cells by targeting specific genes or proteins that may be on the surface of the tumor cell. Essentially, it shuts off or blocks the growth, causing cancer cell death. The targeted therapy can be given through an IV, pill, or an injection. And not all cancer types can be treated with targeted therapy. So again, it's very important to know what type of cancer you have and if there's any mutations or biomarkers that targeted therapy can be used. And next slide, please. Immunotherapy uses the body's natural defenses to identify, attack, and kill cancer cells. Basically, as we age, our immune system can become weak and can no longer detect an abnormal cell or a cancer cell and is not able to clear the body of this cancer cell. So the immunotherapy stimulates or boosts the immune system to help recognize the cancer cells and attack. There are other treatments that aren't listed here, such as endocrine therapy, which is used most often in breast or prostate cancer to help block the hormone that's causing cancer cell growth. And then there's also bone marrow transplant, which wipes out the cancer or damaged cells and replaces them with new or healthy cells. And then there's clinical trials, which require volunteer participants to test drugs or devices or new treatments. All new cancer therapies must go through clinical trials before being approved by the FDA. Next slide, please. Making a decision. Factors to consider and discuss with your team are goals of treatment, potential benefits, type and severity of side effects, reasons behind treatment choice, and cost. And I'll pass it back to Joseph.
Okay, so here, here are some great examples of questions that you can bring to the team directly as you're getting treatment and going through the process. The symptoms and side effects that are affecting me most are, and you can fill the blank in, and how are they interfering with your life in the following ways, and what can we do to manage these symptoms? So throwing back to, there are several things to manage side effects. There's dietary approaches that can help with the help of dietitians. There is the palliative care team to be involved when there's specific or complicated pain, for example, with like pain in your throat or having difficulty swallowing or pain in the mouth from treatment. The goal is to prevent and treat as early as possible. And in addition to any related psychological, social, and spiritual problems as well, as far as treating those. So those are all important to be mindful of. So coping with side effects. Definitely can have side effects from treatment. You want to track them so that you can provide this information clearly to your medical team and they can best intervene. For example, for fatigue, which is a common one, your doctor might ask specific questions like, when did it begin? When did you begin to experience it? Has it progressed since your diagnosis? How severe is it? How long does it last? What eases it? What makes it worse? How does it affect your daily life? Do you experience shortness of breath or chest discomfort? How well are you sleeping? How and what are you eating? What are you feeling emotionally? And there are a number of ways to deal with the emotional side effects, whether it's increasing meditation practices, talking with counselors to problem solve, as well as kind of just process everything that's going on and understand challenges differently in a new way, as well as just kind of whole person care, looking at all the things that are happening. So that could be a presentation in itself. So we'll keep going. Taking the next steps. In regards to information, just be aware that when you're searching online, a website that ends in .org is usually a nonprofit organization, where a .com, a website with a .com signifies a for-profit company. So I like to think that the information from the .org websites are generally more credible. And I encourage caution when it comes to getting information from internet chat boards, or anyone can post because they might be sharing inaccurate information that causes increased stress in other people that might have a similar condition, but obviously very different details. Like as Anna has mentioned before, each person is on a different path and a different situation. So it's very easy to compare when you're looking at those types of forums. So just be aware of that. And having open communication and trust with your medical team, I think, leads to better health outcomes. So be open to help from not only your oncologist and your advanced practice provider, your NP or your PA, but also from the social worker, from the dietitian, from the chaplain, from many other, from the nurse. To be open, because everyone on the team wants to help. They want to feel like they're helping you. So moving on to caregiving. So just really trying to, as much as possible, even in the setting of great stress that can accompany a diagnosis of cancer, take your time to sift through information and try to talk to as many credible resources as possible. And I think the more information you have, and the more people you've talked to, it'll help clarify your decision-making process. And even slowing down, taking a break, coming back to the conversation can also kind of help to refresh your perspective and make the best decision for yourself. So really think about and understand that you have time to make decisions and think about what the best plan is. As a specific caregiver to someone going through cancer treatment, it's important that you both take notes, which is helpful, so you can kind of correct any discrepancies you heard while you were perhaps at an appointment, because when you're in that charged environment of hearing information that might be quote unquote bad news, some people say they'll completely check out and not hear anything. So definitely account for that, and it's helpful to have another person there with you so you can both hear the information at the same time. So that's important, and it's just normal to feel those emotions. You're allowed to feel scared, upset, and overwhelmed. Just want to normalize that. And as the caregiver, you want to be on the lookout for yourself to make sure that you are getting enough sleep for yourself, that you're eating appropriately, you're keeping your energy up, so that you can be your best for yourself, but is also for your loved one. It might be appropriate to enlist outside private caregiving help, if appropriate, to supplement your resources. So having someone to help you in the home. And there are also, there's several private caregiving agencies, as well as things like in-home support services if a patient has a Medicaid insurance that will go along with that. So, key points from that: ask questions, accept support, have hope and courage, like the slide says. Having a cancer diagnosis seems like to be a journey with lots of steps, decisions, obstacles, and lessons along the way. And the sense of control is a very important and salient topic, because getting a diagnosis can cause a person to lose a sense of control in their lives. And getting to a place of seeing or recognizing what are the things that you have control over, and engaging the best way you can in those areas, you will better help yourself to get through your treatment and into survivorship. So some examples of things in those areas can include your attitude and perspective on getting treatment to help oneself, your problem-solving intentions to get through the myriad of obstacles, your flexibility and ability to change course as necessary, your ability to take steps to manage stressors with proven support strategies. It's often hard to imagine the challenges faced every day by our patients, and we oftentimes don't give patients full credit for their persistence and their resilience. So we like to recognize and try to recognize all of those things and all the challenges that the patients overcome in their journey. Anna, did you want to say anything else about those things?
Yes, thank you, Joseph. Very well said. And yes, have hope and courage. Ask for support. I can't say that enough. And ask questions. You know, Joseph talked about caregiving, and family members are part of this too. You know, the term is survivor. You're a survivor from the moment you're diagnosed and beyond. Whether you've had treatment or not have treatment, or if you've had surgery or not, you're a survivor, and that survivor applies to your friends and your family and your loved ones. So it's very important that your family also, I use this example, you know, just like if you're on an airplane, they always say, you know, put the mask on yourself first. And then you can help someone else. So as a caregiver, be sure to take that that bit of information, and so you can help support the cancer survivor through this. Yeah.
Okay.
Mm-hmm.
Thanks, Anna. So we're getting near the end of the presentation. I'll go through and review some of these resources here. The Cancer Support Helpline at that phone number, staffed by professional counselors that you can call. Cancer Experience Registry, which we'll talk about in a little bit. To focus on collecting, analyzing, and sharing information about the experience and needs of patients and their families throughout the journey. Open to Options, a program that can help you prepare a list of questions to share with your team. And then, frankly speaking, about cancer, which is what this is right now, what we're talking on, Anna and myself, Landmark Education Series provided trusted information on a variety of topics. So be aware of those. And then the registry, it's a research survey to identify and understand emotional and social needs unique to the cancer experience, and it informs medical professionals about patient needs to help improve quality of care over time. So it's helpful to share and let the medical teams know how they can improve. There's a timeline of this registry with different types of conditions on there. Information on how to join. You can follow that through the slide. Joining the grassroots movement, being an advocate. Getting up-to-date information on key issues that are important to patients with cancer specifically, being a part of a network that interacts with Capitol Hill and other policymakers for important issues, and having a voice heard alongside other voices of patients with cancer and their loved ones. So you can join down there to feel like you want to do more for your loved one or for other people in your social network.
I just wanted to say, you know, it matters so much to the healthcare providers to hear about the patient's journey and what we can do to make it better, where the support was lacking, or you know, what the experience was. So I think that's great.
Absolutely. Yeah. How else can we improve without knowing feedback or what's worked and what hasn't worked? So definitely encourage checking that out. And then lastly, Mylifeline.org, which is it's a website where you can set up a private social network with your friends and family to help coordinate with help for things like meals, rides, errands, childcare that your friends and family can look at and then sign up for, and you can let them know what is needed. So it's a very organized way versus having to, you know, speak with multiple people multiple times a day, which can be very time consuming. Discussion boards, care coordinators, and then you can control it so that your network or web page is specific only to the people that you allow in for privacy. So check that out. And that concludes the presentation. So I think I can pass it over to Larissa. If there's any Q&A, we open up the floor to any questions or comments or feedback. It looks like we have some chat. Definitely a lot of information that we talked about and presented. So yeah, it's a lot to digest and just kind of a starter to get people thinking and going in the right directions. No questions yet.
Sometimes we're afraid to ask questions, but it's probably a question that someone else has on their mind. So it's
so true.
Yeah.
Q&A questions can also be submitted anonymously.
Oh, good to know. So Sandra H says, may I see the slide before coping and side effects? See if I can go back. Questions to ask during treatment. Was that the slide that you were wanting? Yeah, did you have a question about this slide?
We have a comment from Anonymous that says, thank you for this. You're very welcome. I think I love to go out into the community and talk to patients and present on different topics. So. Sure. There's a question. Can you please talk a little more about the option to record your visit? I think that's a great idea because sometimes we need time to process our thoughts. Absolutely, 100%. Just before, or after the introductions with the provider take place, just say, is it okay if I record this visit? And you'll have your answer at that point. So long as the people in the room are aware that the recording is being done, there's nothing illegal or wrong with that, but make sure that you do ask first. It shouldn't be a problem. I've had many people do this over my 15 years experience. So yeah. Joseph, there's another question, says, do you recommend any support options for spouses or children?
Yes, absolutely. Yeah, there's a lot of support for the caregivers. There's specific caregiver support groups, and when I say caregiver, that can be friend or other family member, but usually it is the spouse. So there are specific caregiver groups at Cancer Support Community, and then also through ImmermansAngels.org. There's a way to connect with a caregiver to someone who has a specific condition to what your loved one is going through. And for children, yeah, there's also a lot of, I shouldn't say a lot, but there is definitely resources out there. So things like camps called Camp Kesem is one that comes to mind, where kids of parents who are going through cancer can connect with each other. Now it's all virtual and done at home, but they do activities together, and kind of are able to connect and feel less isolated. Walk with Sally is another one for families in Los Angeles and I believe Orange County, that you can get assigned to, the child can have a mentee, or I'm sorry, a mentor to be connected with. So there's that, and then we also have a child development center next to us that offers counseling and supportive care through them, and also the social workers like myself and my other colleague Caroline can also work with parents on different strategies to help with managing their kids' feelings, how to talk to their kids, and ways to support them and ways to help open communication in a way that makes them feel involved and like they understand. Yeah, really important parts to consider.
Yeah, those are definitely some excellent resources, Joseph. And, I think you mentioned the feeling of isolation, and I can't, we're sitting here with our masks on, for the safety of our coworkers and patients. So, during this time, that isolation has definitely been magnified beyond anything I've ever experienced. So these virtual support and resources are so important, and cancer support community has so many resources available for the patients and the caregivers, family members and such. So definitely take advantage of what's out there.
Absolutely. Yeah, and Larissa, is it easy for attendees to get access to the slides after the presentation?
They are more than welcome to email info@cancersupportla.org. We may be able to share them, and I will be typing that email into the chat now.
Great. Yeah. So if you wanted to see the specific slides, but I can try to find the one that there's a request to see a slide after immunotherapy, which I think, they're after immunotherapy. So making a decision was one. And slide before question to ask during treatment, before questions to ask during treatment. And there's the email in the chat box to get the access to the slides, so you can see all the slides that you want from the presentation. So there's that. Questions to ask during treatment. Let me see if I can find that.
Yeah, there's a lot of excellent resources at the American Clinical Oncology, let me make sure I have that right, website, and it's specific to patients. So definitely look at that.
Any other questions out there? All right. Well, thank you to Cancer Support Community and Larissa for helping us and inviting us to be able to share this information with you all. And thanks for joining. It was a real pleasure.
Yes. Yeah. Thank you very much to all the attendees, all the participants. Thank you for your questions. And we will carry on. So, all right. Thank you.
Thanks so much.